Guideline of use PPE. Infection Control Unit. Proper PPE selection is based on the isolation precautions or procedures. We have contact, droplet, airborne isolation. For contact precaution, PPE needed are gown and gloves. Other PPE if needed. The healthcare worker must wear PPE before touch the patient or surrounding. For example, MRSA, VRA, diarrheal illnesses, scabies, Clostridium difficile.
PPE for droplet precaution is surgical mask. Other PPE if needed. Indications of droplet precautions. Care of suspected or confirmed patient with droplet transmitted disease, for example, influenza, Haemophilus meningitis, Neisseria meningitis, mumps, pertussis, plague, rubella, Ebola, MERS-CoV, COVID-19. The healthcare worker must wear surgical mask before enter the patient room and remove it after leaving the patient room. Note: some infections need to combine more than one type of precaution. For example, COVID-19 require applying both droplet and contact precautions. So healthcare workers should wear surgical mask, clean non-sterile gloves, and isolation gown.
PPE for airborne precautions is high-efficacy respirator mask, or PPER. Other PPE if needed. Indications of airborne precautions. Care of suspected or confirmed patient with airborne transmitted disease, or aerosol-generating procedures, for example, measles, open pulmonary TB, draining extrapulmonary TB, herpes zoster, chickenpox.
What does the aerosol-generating procedures mean?
Any medical and patient care procedure that results in the production of airborne particles. Healthcare workers should wear a respirator mask or PPERS, eye protection, gloves, and a gown when performing aerosol-generating procedures. Procedures considered to be aerosol-generating: endotracheal intubation and extubation, manual ventilation, open suctioning, cardiopulmonary resuscitation, bronchoscopy, surgery and postmortem procedures involving high-speed devices. Some dental procedures, for example drilling. Non-invasive ventilation, NIV, for example bi-level positive airway pressure, BiPAP. Continuous positive airway pressure ventilation, CPAP. High-frequency oscillating ventilation, HFOV. Induction of sputum. Open suctioning of airways. Tracheotomy. Tracheostomy procedures: insertion, open suctioning removal, nasopharyngeal swabbing.